Good afternoon, ladies and gentlemen. My name is Tyrell Hill. I am currently a junior at Methodist University with a major in exercise science and sports medicine. I chose that major because I run track for the school, and in my personal life, I'm a professional martial artist and boxer. And my minor is in military studies, being as I am an active duty soldier, and I'm also a part of the ROTC program here at Methodist University, looking to commission next year. So, we're going to dive down the very, very long, tedious process that it took me to get to my final research process. We're going to start with my first research question. So, initially, my research question was, what is the cognitive benefits of combat sports for the athletes, basically? And after spending about the first 6 to 8 weeks trying to compile information and get together data to support this research question and be able to prove my theory that combat sport athletes have a higher level of cognitive perception. Um, it was almost for naught. Had to have a meeting and sit down with Dr. Robbins, and during that time, we were speaking about it. Some of the information I brought together was it was hard. For those of you that do not know, the sport of mixed martial arts is only about 27 years old. So the scope of information available for it is going to be very limited in the big scheme of things compared to other sports and other research studies in the world. Um, so once I said it out loud, also, it kind of was almost like a duh moment for me because individuals that do not have a higher level of cognitive processing would not participate in the sport, any combat sport in the first place, or they won't be successful. So once I kind of placed those factors together, I kind of realized that that might have not been the best research topic to choose on. But this was already about 6 weeks in. I spent so much time trying to prove this theory, trying to prove. I was like, I knew it, little bias also. I'm gonna own up to say that because of course I felt like being a combat sports athlete gave me a higher level of cognitive process. It made me made me great. But yeah, also once I said I was like, probably the reason that you're good at this is because you probably might have already had this trait or this skill per se. That's kind of what allows you to have success in the sport in the first place. So one of the topics that I already had used because as mixed martial art, it is a mixed sport. It pulls from boxing, it pulls from wrestling, it pulls from taekwondo. So I had some research from all of these sports that I was trying to compile together to back my theory. And one of them happens to have been on the effects of boxing on Parkinson's disease. Now I know when everybody thinks of Parkinson's disease in boxing, they think of how boxing causes Parkinson's disease, and they kind of think of it like that. The most notable person being a patient of Parkinson's disease is the most famous boxer in the world, Muhammad Ali, my favorite boxer. Also, I think back to the 1996 Olympics when he was looking to light the Olympic flame and he was having really bad tremors. And for those of you that do not know, one of the symptoms of Parkinson's disease is they'll have one hand that tremors, one steady, one will tremor. And that was we seen he was having a really hard time struggling to light the flame due to the hand tremor. But that is the research topic that I chose currently. We're looking at the positive effects of boxing with patients who currently have Parkinson's disease. Not vice versa, not how boxing causes Parkinson's disease. How Parkinson, the effects of boxing on Parkinson's disease help with those symptoms. And now we're going to go down the new rabbit hole and show you guys the research and review this. Here we go. Boom. Right there for you guys to see. The effects of boxing on Parkinson's disease. Now, for those of you that do not know, Parkinson's disease is a disorder of the central nervous system. It affects movement, often includes tremors. The neurological condition causes tremors, weakness, difficulty walking, balancing, and also affects your coordination. And a lot of times you see they will sometimes suffer from depression, they have issues sleeping. Sad to say, the list goes on and on. There is a wide range of the effects of Parkinson's. Now, there are quite a bit of tried and tested interventions to try to combat some of the symptoms of Parkinson's disease. Because sad to say, there is no current known cure for Parkinson's disease, but plenty of people have used walking, running, strength training, even whole body vibration to attempt to kind of combat some of the symptoms. They've used functional exercises, but the one that we're going to focus on is boxing. Uh, Boxing is one of the notable physical exercises with significant impact on Parkinson's disease, with research that was shown by boom, Eurita, and I apologize if I butcher your name. I used your research, but I am not an English major or say that word, and I apologize. But based on the study, he saw a reduction in depression from the patients as they were able to kind of get a sense of camaraderie and get bonding from some of the other uh, patients that were going through the boxing regimen during the 6 week high intensity plan. It also helped affect their overall quality of life. They saw a lower increase of falling due to boxing making them have to focus on their balance, their core stability, and their overall motor control. Also, before I back away from this, let's go on and look at that bottom part. Boop. So it had a positive impact on their daytime sleepiness and on their overall ability to stay asleep at night as well, according to the research. And additional research provided by Dawson in 2020, there was significant improvement in 62 Parkinson's disease patients who participated in what's known as the Rocksteady Boxing exercise. So Rocksteady Boxing is a nonprofit organization that is using boxing to combat Parkinson's disease. It is they have based out of a university in Indiana, and they are continuing to do studies. They're also offering courses and classes for individuals to be able to take this up as well. And so in that study, they utilized two tests. The first one was the 30-second sit to stand test and the time up and go test. The participants recorded significant improvements after the first and second Rocksteady boxing sessions, which is almost, for being honest, that's phenomenal. To be able to do one or two sessions or something to be able to almost see immediate results was one of the things that led me to want to dive even deeper down this research program. And to be honest, even look something for the greater Fayetteville Cumberland community as well. Another study set by Combs sought to determine how once again boxing affects Parkinson's disease, and this time it only included 6 patients with Parkinson's disease, but this one they attended about 24 to 36 boxing sessions spread out over 12 weeks, and some of the exercises were the boxing drills. They did stretching, strength and conditioning, and traditional running and other endurance exercises. They used tests like the timed up and go test and the 6 minute walk test to find that the to find improvements no matter the severity that they initially came into for their Parkinson's disease. The patients in the clinical trial had improvements in their posture, their gait, and once again their everyday quality of life. The third study I looked at was a study by Domingos. It showed that participants in the program had significant increase in their physical ability after the boxing training sessions. They improved in strength, stability, and it proved to be essential for the psychological status of the clients as well, patients as well, because they were able to, as before, get that emotional support for one another, which was able to lower their stress and anxiety and just combat depression, which a lot of the patients that some of when I actually looked up a few videos as well on YouTube on this to kind of help to supplement some of the help supplement with some of the studies I was finding as well. For instance, with Rocksteady Boxing, I looked up quite a bit of the YouTube videos on that to go along with the digital research. And it was the support system that they were able to get from one another that was probably one of the main things because when your quality of life is compromised, they're starting to kind of get slightly depressed, get down in the dumps, and to be able to have almost that instant gratification, knowing that when you're putting your effort into something, when you're doing something, you're starting to get that feedback. A lot of the clients were saying it was it's great. It changes their mindset, and then to see other people doing it as well, it just gets that camaraderie all together. And that's one of the similarities that I noticed in all of the studies. The study by Combs, the study by Urita, the study by Dominguez and Dawson, and a study by Morse as well, where he had opened up a community-based. This one wasn't tied to the Rocksteady, it was its own community-based one, where the main benefit that they were seeing, in addition to the improved strength and stability, was the emotional support and that they were able to provide for one another, and how they were able to keep one another on goal, on focus, to keep on going forward to try and accomplish these tasks and want to get better overall. The study by Morris evaluated the evidence on this. So they had 37 participants in this one, and it's one of the few studies that's applied the full intervention. The only downside of this, as we're going to talk about now, was some of the studies had a possibility for bias. Some studies only included men. The downside with participants having Parkinson's is that they lose the ability to drive, which means that they might not be able to make it to all of the they might not be able to make it to all of the scheduled sessions, and some patients might not even be able to have access to go to be able to engage in these drills at all. Another detriment that I noticed was that there was no set time amongst the studies. Some of them, like I said, one span from 12 to 24 sessions. Some were for 6 weeks. Some were for 12 weeks, and then some I couldn't even find the time that was on the studies as well. There's a wide range of websites that support the use for boxing to combat Parkinson's disease. For instance, Rocksteady Boxing being one of the most prominent ones that I was able to find. But none of the all the data is not verified. So it's kind of there's a major need for more studies. Me myself, I would like to actually look to do something like this in the current area. Um, I, as a martial artist and gym owner, would like see the actual impacts and effects that this has on the long term. Because the only information I was able to find was all for short term, be this over a few weeks or a couple months at the most. But when I watched those videos, I kind of felt like I was starting to get entangled with the patients, and seeing them be able to take back charge of their life, get that mobility back, change their psychological state. I would love to be able to be a part of that, and that's why I think there is definite need for further research. And I'm personally going to volunteer to do that for here as well. um I know this is a video, so you guys aren't able to actually ask questions. If you have any questions, please leave them in the comment section, or yeah, here's my reference list. This was a awesome study. I learned a lot about myself. I learned a lot about the research process overall, and I learned that I am not quite the researcher I thought I was. It seems that with the oversaturation of technology leads to the dependence on it for accuracy. For example, when I was first starting out, I was utilizing Scholar quite a bit to get some of my information, and that was my main go-to database. And I was using that for my peer-reviewed scholarly articles. And a lot of the times, I was realizing that that was not the best asset. So just being honest with myself and relying upon the instructor, looking back on some of the notes, and using that to further guide myself, I was able to put put together more conclusive evidence, put together better peer review articles that actually are up to standard and be able to accomplish the literature review and put together actually a decent annotated bibliography. Uh, like I said, I had some hard times throughout the course trying to put the information together. One, the first thing that my first personal uh, shortcoming was that I bit off more than I could chew with the question. That was a very broad topic that was maybe a little too self-serving, and that I couldn't find a way to actually pinpoint um, actual research and data on it. And that should have been my first factor to know that this might be too much and to go for something else. Secondly, if you can't get conclusive research on one or two searches in a proper scholarly site, scholarly peer reviewed like one search like the university uses, then it's time to look for something else. That was something that I'm gonna go forward with my college career and my as a researcher. My third one, as I said before, having too much technology almost makes it a detriment towards us. I thought because we have Google, Siri, and all other things, I figured I was great at research. If I wanted to know anything, I had so many avenues, options to look it up. But just because I was looking it up does not mean that I was able to get the proper evidence and research and data, as I noted throughout the majority of this. Um, Going forward, this is definitely something that I hope other researchers and physical therapists, physiatrists, coaches, trainers, and patients suffering from Parkinson's disease decide to delve into, whether it be as a participant and advocate or as a researcher, because it does seem to have some great feedback from the participants that I was able to see in the research. The only thing is it's not conclusive, sad to say. And that concludes my presentation at this time. Thank you.